our trial, as I said, will be a double-blind, randomized trial of fecal microbiota transplantation in Parkinson's disease. So essentially, we will use the test that I mentioned to select patients into that trial. So meaning that our aim is to recruit only those patients that have a detectable and measurable abnormality of the gut microbiome. And I think that this distinguishes our trial from the other ones, because the other ones, to my knowledge, mostly recruit basically every Parkinson's patient that fulfills the inclusion criteria. So we're using this biomarker to narrow that population down. And while we are recruiting patients with a Hoehn and Yahr stage up to 3, so meaning that those patients are in the early to mid stage of the disease. And our primary outcome measure will be the combined MDS-UPDRS 1, 2, and 3. So basically, we will be measuring symptoms or impact of the disease on activities of daily living, on certain non-motor symptoms, and on motor symptoms as well. So we have this combined outcome measure because based on animal data on fecal microbiome transplantation, it seems that this procedure could have a quite broad impact on many different disease symptoms. So it has been shown that mice may have less motor symptoms, but it may also be that this impacts also non-motor symptoms, for example, depression or pain or gastrointestinal symptoms and these kind of things. So since we don't really know which will be the strongest effect, so we chose to use an outcome measure that captures all these different aspects. So essentially, efficacy can be demonstrated either by reducing motor symptoms or by reducing non-motor symptoms, or by reducing both. And in addition, we have a lot of other markers, quality of life measures. We will objectively measure gastrointestinal transit time, so measuring how fast the gut is moving, basically. So seeing constipation really objectively measured. The actual intervention will be a colonoscopy-based transplantation from a donor. And so there's different possibilities. One can also do a nasojejunal tube, so basically through the nose, but we opted for the colonoscopy because that is the method that has been most frequently used in our hospital. And so our gastroenterologists are very have a good routine in performing these procedures, and that's why we chose it. And we'll measure take a lot of biosamples, biopsies, blood, urine. We'll measure permeability, obviously stool samples, very, very many. So basically to also be able to measure target engagement. So looking at what are the physiological pathways that we can impact with fecal microbiome transplant.